Treatment. Published by Physiopedia. Description. Neurodynamic treatment falls within manipulative therapy, a group of techniques that aid in pain relief and restoration of functional mobilization. As a treatment technique, was introduced nearly 30 years ago and comprised of 16 techniques, closely resembling neurodynamic assessment. Neurodynamic assessment is used to evaluate the length and mobility of the components of the nervous system. Neural mobilization generally consists of techniques termed neural glides or neural flossing. Neural stretching is also performed as a mobilization technique. Although glides or flossing is also seen by some as a stretch, they are generally more dynamic in nature. Objectives of neural mobilization. The main objectives of neural mobilization are two. 1. Achieve overall balance in the nervous system. 2. Restore balance to the dynamic neural structures and the surrounding mechanical interfaces, by restoring the slide and glide of the nerves. This is performed through pressure relief on affected structures. And 3. Normalizing the intraneural environment, through 1 and 2. Median nerve glide. Indication. The median nerve glide is indicated for various upper limb conditions including various upper limb nerve entrapment syndromes. For example, carpal tunnel syndrome, cubital tunnel syndrome and non-acute cervical radiculopathy. Procedure. Position. Patient supine on plinth. Shoulder in 90 degrees abduction and externally rotated. Forearm in supination. Wrist in neutral with fingers in supination. Therapist. Restraint is placed across a acromioclavicular joint to prevent shoulder girdle elevation during shoulder abduction. Extra support is placed under distal arm. Procedure. See picture opposite. For gliding techniques, elbow and cervical movement are done towards the same direction. When right elbow is flexed, cervical lateral flexion to the left is performed. Diagram A. For tensioning, stretching techniques, movement is done in the opposite direction. For example, when the right elbow is extended, cervical lateral flexion to the left is performed. To complete the motion, cervical flexion to the right is performed while right elbow is flexed. Diagram B. Diagram C and D depict extension of the elbow with head held in a laterally flexed position away from the arm being extended, C, and towards the arm being extended, D. Diagram E and F depict lateral flexion of the neck while the arm is kept in a more extended position, E, or a more flexed position, F. Amplitude of range is done in the range where no discomfort is felt. Radial nerve glide. Indication. Tingling down the thumb side of the forearm, caused by pressure on the nerve. Procedure. Position. Patient stands in a relaxed position. Therapist. Guides patient through the movement, uses verbal or tactile cues. Procedure. Depress shoulder, flex wrist, internally rotate wrist, add lateral and cervical flexion, finally add wrist flexion as shoulder is extended. Movement should be done until gentle tension, with no pain involvement. Ulnar nerve glide. Indication. Pain or dysfunction in the ulnar nerve distribution. This includes ulnar nerve entrapment. Procedure. Position. Patient stands relaxed. Therapist. Provides verbal and tactile cueing. Procedure. 1. Shoulder forward flexed, elbow extended, wrist and fingers flexed. Slowly move fingers and wrist into extension while keeping the elbow straight. As a second movement, flex the elbow while keeping wrist and fingers extended. 2. Now move arm into an abducted position, out to the side of the body. Gently flex the wrist, externally rotate the arm, and gently laterally flex the neck in the contralateral direction. Another procedure for mobilizing the ulnar nerve can be found in the video below. Cervical lateral glide. Indication. Pain in the upper quarter. This includes the neck, shoulder, arm, upper back and/or chest. This pain may or may not be associated with headache. In addition, positive signs including active movement dysfunction, passive movement dysfunction, adverse responses to neural provocation tests, hyperalgesic responses to palpation of related cutaneous tissues, evidence of related local area of pathology. Procedure. Position. Patient supine, the shoulder slightly abducted, with a few degrees of medial rotation. Elbow flexed to 90 degrees so that patient's hand rests on their chest, abdomen. Therapist. Supporting the shoulder over the acromial region with one hand. With the other hand supports the head and neck. Movement. Gentle, controlled lateral glide to the contralateral side of pain in a slow oscillating manner up until the point of range where resistance is felt by the therapist. This is before pain. Shoulder girdle oscillation. Indication. As with cervical lateral glide. Procedure. The procedure for shoulder girdle oscillation is as follows. Patient position, prone. The involved arm is comfortably supported by the physiotherapist towards a position of hand behind the back. Therapist, holding patient's one hand behind the back, the other hand over the acromial area. Movement, gentle oscillation of the shoulder girdle in a caudad, cephalad direction. The range is done to the onset of initial resistance palpated by therapist in caudad direction. Progression, gradually increasing amount of hand behind the back position. Slump stretching. Indication. Most often this technique is used for individuals who suffer from lower back pain, LBP, non-radicular in nature and display mild to moderate mechanosensitivity, often more distal in nature. This sensitivity can be tested through the slump test and the straight leg raise, SLR, test. Procedure. Position. Patient in long sitting with feet against the wall, to ensure ankle remains at 0 degrees dorsiflexion. Therapist. Applies overpressure into cervical spine flexion to the point where symptoms are reproduced. Duration. The position is held for 30 seconds. Repetition, 5x. As a home exercise program. Done as a self-stretch. Position. Patient in long sitting with feet against the wall. Patient provides own overpressure with upper extremities until symptoms are reproduced. Duration. The position is held for 30 seconds. Repetition, 2x. Straight leg raise stretch. Indication. The same as for the slump stretch, glide. Procedure. 2 procedures can be described for the lower limb and are as follows. Procedure 1. Position. Patient lies supine on the plinth. Therapist. The therapist passively raises the patient's leg into SLR until the initial onset of pain. Hip is then flexed and extended in a small range of motion, GRIV. Duration, 2 minutes, with 1 minute rest in between sets. Repetition, 3 sets. Procedure 2. Position, patient inside lying, leg to be worked, on top. Therapist, supports leg and oscillates joints, knee extension, hip flexion and ankle dorsiflexion. Duration, 10x. Repetition, 3x. Resources. An article demonstrating different neural glide techniques. Different nerve gliding exercises induce different magnitudes of median nerve longitudinal excursion. An in vivo study using dynamic ultrasound imaging.